From our State House studio in Montgomery, I'm Todd Stacy. Welcome to Capitol Journal. The legislature was back in action today as the House and Senate met for the 18th legislative day. It was Military Appreciation Day in the State House as lawmakers invited some of Alabama's highest ranking and most decorated military leaders for a special ceremony honoring their contributions to the state and the nation.
Last month I was able to go down to the southwest border, and if you didn't know this, Alabama has a significant, I can't tell you how many, we have a significant number of soldiers that are down there helping on the southwest border. The 226 Maneuver Enhancement Brigade out of Mobile, Alabama are responsible for all 2,000 miles of that border from the Atlantic Ocean to the Pacific at that brigade level. So they oversee that, working out of El Paso and doing fabulous work down there. I've heard nothing but remarkable things about that command team.
The House and Senate also passed a number of bills seeking to make Alabama more hospitable to military families. Let's take a look at some of those. House Bill 103 from Representative Kenneth Pascal is an overhaul to the state's Veterans Affairs Code that is meant to better organize the department and help it streamline services to veterans. House Bill 284 from Representative Jerry Starnes would update Alabama law to ensure that schools that waive tuition or fees for incoming military students can offset those expenses through write-offs. Senate Bill 209 from Senator Andrew Jones would exempt National Guardsmen and reservists from state income tax while they are deployed either to an overseas theater or to a domestic emergency. And Senate Bill 206, also from Jones, aims to ensure that military kids can join sports teams even if they move to a new school in the middle of the year. All those passed today, and we'll move to the next chamber. Today in the House, a major overhaul of the state's ethics code was debated. House Bill 227 from Representative Matt Simpson aims to reorganize the prosecutorial jurisdictions between the Ethics Commission and the Attorney General's office. Interestingly, both the Attorney General and the Ethics Commission director have come out against the bill, which led to several questions from members on the floor.
People have asked why would I take up this issue, this third rail of politics? When I was elected in November of 2018, the second thing that we did the next week after the election, we came in and had orientation. At that orientation process, there was a panel of ethics attorneys. There were 3 ethics attorneys on that panel. When members of the legislature were asking the question and answer as to what happened, and please, there are several members that were still here when this happened. When members of the legislature asked the attorneys who practice, who specialize in ethics in Alabama, what we could and couldn't do, we got 3 separate answers. One attorney would say yes, one attorney would say no, and one attorney would say it depends on the situation.
That bill passed with a vote of 79-9, with several members abstaining or not voting. It now moves to the Senate. The Senate County and Municipal Government Committee met today, resuming its meeting on legislation aimed at reforming the way state licensure boards are governed. Senate Bill 224 from Senator Chris Elliott would require more than 3 dozen occupational licensing boards to be managed by a new state agency rather than by private contractors. Elliott has argued that the management of these boards has become a for-profit cottage industry that doesn't serve the interests of workers. But he got pushback from Democrats who, perhaps surprisingly, argued that it was just more big government.
We have seen significant problems. We have seen non-compliance with the law. We have seen licenses being issued that were improper. We've seen lack of enforcement and cooperation with law enforcement in certain instances. We've seen mishandling of funds. So what we are seeing is that there are huge problems with the operation of these boards that are handled by private, for-profit institutions, and that there is, frankly, mismanagement, and that is documented in the audits performed by our examiner of public accounts.
I think people have said before, I do not wish to have, however good intentioned, individuals may be who for the most part may be representing the person who performs heart surgery on me should not necessarily be the individual who's a geologist. So if you have boards who have the specialty of what they do, why not have, I just don't know why we disrupt that. If we have mechanisms in place to address what you all say you have identified as the individuals who do need the attention, because this is, and I trust the fact that you all have seen this information and you've seen the problems. Can we not address it without applying new legislation? Because just as Senator Madison Coleman has said, you know, my friends across the aisle from days of old in the Republican Party that believed in small government, this is definitely adding to it. So with that, you know, thank you, Mr. Chair.
That bill was reported out of committee and now goes to the full Senate. The Joint Prison Oversight Commission met today for an update on the prison construction projects from Commissioner John Hamm. Hamm said that the Elmore project is at 25% completion and slated for opening in 2026. However, Hamm cautioned lawmakers about the potential challenges posed by the rising prison population.
Inside the fence is going to be roughly 300 acres, so it is quite large. Our largest facility now is Limestone, about 2,300 inmates, and it's on 64 acres. So it's large. There were 497 construction workers on the site, which that's a lot of construction workers. However, that's probably half of what will be there in, you know, a couple of months when things will ramp up. So we're looking at probably 800-900 construction workers total on site. But give an example, if we have one correctional officer watching 10 inmates, we're trying to get to 2 correctional officers with all of our hiring and training. We're probably 1.5 now, but by the time we get to 2, there won't be 10 inmates, it'll be 20 inmates. So we're trying to get information on how that population is going to look in the next several years.
The commissioner also addressed efforts to improve communication with families of prisoners facing health issues or emergencies. The Department of Corrections has initiated the establishment of a dedicated family services unit. This unit will be stationed both at DOC headquarters and each prison facility, aimed at keeping family members informed about the well-being of their loved ones.
We will be able to have that one individual at the facility dedicated to run those answers down for the family and respond back to them in a timely manner. Also, another part of it is notification on hospitalizations, because we do have inmates that go outside the facility to have an overnight stay in hospitals. We have started that maybe 2 months ago, I believe, where we have dedicated individuals to call family members when they have been hospitalized. And we have had a lot of positive interactions with the family members. That has really gone well, where we call and give them an update on what their condition is.
People distrust what they don't understand. And they can't understand if they're not receiving communication. So I think this is a positive direction. What is it that we need to do to help you implement this, to push it across the line?
We felt like, okay, you know, we're serious, so let's put it in law. So, you know, my time's limited, so when I leave, whoever the next commissioner is, that will still be there that they have to follow through on.
Healthcare advocates gathered at the State House today. The Cover Alabama Coalition is a group of organizations dedicated to expanding access to affordable health care in Alabama. Whether that is through Medicaid expansion or a more nuanced public-private partnership, the group argued that the state stands to benefit from closing the health coverage gap.
We believe public policies should make it easier for individuals to get their rights, not harder for them to get their rights, and easier for Alabamians to make ends meet. And we believe that everyone in our state should be able to get medical care. They need to be able to survive and thrive. We're excited to have more than 200 supporters here with us today at our annual Legislative Day.
Coming up after the break, I'll sit down with Carla Crowder of Alabama Appleseed to talk more about the prison situation. After that, Honor Hill of the March of Dimes joins me to talk about the coverage gap and how it impacts maternal and infant mortality rates. We'll be right back.
You can watch past episodes of Capital Journal online at video.aptv.org. Capital Journal episodes are also available on APTV's free mobile app. You can also connect with Capital Journal and link to past episodes on Capital Journal's Facebook page. And you can listen to past episodes of Capital Journal when you're driving or on the go with Capital Journal podcasts. Keep up with what's happening with Capital Journal.
Welcome back to Capital Journal. Joining me next is Carla Crowder, Executive Director of Alabama Appleseed. Carla, thanks for coming on the show.
Thank you so much for having me.
Well, we're talking about prisons. We had this Prison Oversight Committee meeting today, and it's apropos because, if I understand correctly, today marks 5 years since that DOJ report came out about the violence and problems with Alabama's prisons. Is that right? April 2nd?
That is right. And what that report did is it set off just a wave of, unfortunately, really negative media attention on the state of Alabama from all across the country. And it also created some awareness by our elected officials that, okay, we're going to stop, kicking the can down the road. This is serious. People are dying. The federal government is breathing down our necks. So we're going to do something about this. There were press conferences, there were reports, there were statements. And here we are 5 years later, and the only thing that's happened in terms of inside these prisons, they've gotten more violent. There have been more deaths. There are more drug confiscations. There have been no increases in positive programming or staff. So 5 years of what I consider a lot of broken promises and a lot of suffering.
Well, they did move to passed a law saying they're going to build 2 new prisons. One's under construction right now, running into, kind of running up some expenses there. But they did try to fix the facilities problem with the
Great point. So Alabama will be building the most expensive prison in the country. It's going to be over $1 billion. And at the Oversight Committee meeting this morning, there were some really interesting points that came out about that construction. So that prison will hold estimated 4,000 people. And as Representative Jim Hill pointed out, the legislation required some other prisons to be closed. It also requires a second 4,000-bed prison to be built in Escambia County, but that hasn't been funded. So if you look at the math, the overcrowding will not end. These new expensive prisons are just replacement beds because some of the facilities are so old they have to close.
Right, but listening to Commissioner Hamm and also the lawmakers involved in this plan, it's a different type of prison. It's not necessarily a big old dorm, people sleeping on top of each other. It's more of individual cells and things like that. They argue that's it will be a safer environment, even though it's the same amount of people.
I certainly hope if we spend $1 billion on a prison, it will be safer. But again, there are 21,000 people in the custody population of ADOC. That one prison in Elmore County holds 4,000. So perhaps we'll create more safety for 4,000, but nobody has an answer for the thousands left behind who won't have access to that facility. And there will still be extreme overcrowding. There's also not been any really well-defined plan to recruit new officers, because right now, similar to conditions in the last 10, 15 years, the DOC has been dramatically understaffed. Despite another thing the legislature has done is huge pay raises for DOC officers. So now you can start working as a prison officer and make well over $50,000, which is a step in the right direction. But it hasn't resulted in massive numbers of people saying, I want to work at DOC.
Well, of course, yeah.
Yeah.
It's really dangerous job.
It is a really tough job.
We only have a little bit of time. I wanted to talk about this, what happened at the Oversight Committee. A lot happened, really. There's so much to talk about. But this idea of we're going to communicate better with family members of inmates. I guess there's been a lot of complaints from family members of incarcerated people. And so talk about this. What would this look like? Is this a step in the right direction in terms of communication?
Oh, wow. It is a great step in the right direction, but a very small step. So as you may remember, at the public hearing of the Oversight Committee, there were over a dozen families talking about their loved ones being stabbed, being raped, being assaulted. This happens daily in our prisons. And there's very little communication to families. Is my loved one still alive? Is he in the hospital? What happens to his body
Just
once
not
he
knowing
dies?
is
Not knowing,
torture, yeah.
and not getting that information. So what Commissioner Ham said is, they want to appoint an individual in each prison and then have somebody in the central office who is the point person for families. And they're calling it a family services unit. But what he wisely stated is that this needs to be in legislation. So, when he retires, they get a new commissioner, we still have the family services unit. So we really look forward to seeing that legislation. I haven't seen anything yet, but I don't believe anything like this will really happen. It will be enforced unless it's in a bill. So we need to see a bill.
That is something to look forward to. I'll be following that closely. Speaking of legislation, this second chance bill seems to have some legs this time. There was an op-ed in the Daily News earlier this week from a mother of an inmate who falls into this kind of slim category of nonviolent offenders who were sentenced under the habitual felony law, but would be allowed to be resentenced by a local judge, could be under the 2015 reforms. Do I have that about right?
You're close enough.
Okay.
It's complicated, yes. So what we're looking at is older people we call them the old men in honor dorms. They have done their time, they've served enough time. They would never be getting life without parole under current sentencing practices and law. So we have support from such an amazing bipartisan group of people. Former Congressman Spencer Backus has been a champion. Representative Bedsole has been really amazing. Our sponsor, Chris England, has been a champion as well. And so what this says is that if you're serving life without parole and you have crimes with no physical injury. In many cases, these people never even saw the victims in their cases because they were burglaries. Then let's get you in front of a judge who can look at what you've been doing in prison. Do you have a good institutional record? And hear from the victims. Because at Appleseed, we've actually done some of these cases where we've gotten agreements from district attorneys. We always reach out to the victims, and they either have passed away from natural causes because the cases happened 30 years ago, or they look at us like we're crazy because the person, who broke into their house 30 years ago is still locked up, and they had no idea that person would still be in prison, and they rush to support release. So we want victims to be heard. We want DAs to be heard. We want this to be a really fair process, but we need judges to review these convictions. And then when people get out, we need to provide reentry services. At our office, we do that. Our recidivism rate is 0%. My clients are now filling jobs at car dealerships, driving 18-wheelers, working in tree services. So this is a workforce bill. It's a compassion bill, and it's also economic common sense.
We're out of time, but thanks for coming on and explaining all this and talking through it. I know we'll talk again because this issue is not going away, but thanks again for your time.
Thank you so much, Todd.
We'll be right back.
You can watch past episodes of Capitol Journal online anytime at Alabama Public Television's website, aptv.org. Click on the Online Video tab on the main page. You can also connect with Capitol Journal and link to past episodes on Capitol Journal's Facebook page.
Welcome back to Capitol Journal. Joining me next is Honor Hill of the March of Dimes organization. Honor, thanks for coming on the show.
Glad to be here.
You were part of this press conference today talking about closing the coverage gap, closing the insurance healthcare coverage gap. But obviously, March of Dimes, y'all focus on women and infants and that whole space. Talk about where we are and that mortality rate and the contributing factors.
Yeah, absolutely. So we're very proud and happy with the things that we've done as a state in the last couple of years around moms and babies. We've expanded to join 43 other states and having postpartum Medicaid extension to 12 months. However, we still, as that gets in place, as people start using that, we have to realize we're still have really bad rates of maternal mortality and infant mortality, and we're third worst for maternal mortality here in Alabama. And what we do know is we also have a high burden of chronic disease, both for our families, but especially for those moms who then go on to carry babies and have pregnancies that may result in preterm birth. And we do know that preterm birth is associated with things like hypertension, diabetes, smoking, things that could have an intervention before mom even becomes pregnant, so that we don't see those negative birth outcomes like preterm birth.
So yeah, and I remember some of these bills passing. It's like, let's make sure that pregnant women have health coverage in a year after and all that. So things like that matter and are important.
Absolutely.
But they might not have health insurance before that and aren't doing the kind of things that maybe might prevent some of these things. Is that what you're saying?
Yeah, absolutely. So when you have a woman who becomes pregnant who might have a chronic disease, we want to make sure that chronic disease is managed. And so getting women into care even before they become pregnant is a really important piece of preventing women from having issues that impact their pregnancy. Pregnancy is only 9 months, and a very important 9 months. That's why we need to make sure that they have coverage, but you can only do so much in 9 months. If we have women healthy even before they get pregnant, they have access to care, they have access to blood pressure medicine, to blood sugar medicine, to talking with their doctor about a healthy weight and what that looks like before getting pregnant. Women having that care before they even get pregnant means that the conversations that we're having with women during pregnancy can be focused on that baby, on her, on having healthy pregnancy, and not focusing just on the chronic disease. So making sure that that is happening so that we can have healthier pregnancies, so that the access she has during that can continue, and then 12 months postpartum, okay, great, she has coverage for those 12 months.
But what about after that?
Right. And most women, you see families who have kids who are 2, 3, 4 years apart. So you have a mom who's gotten onto her chronic disease management while she's pregnant, or even postpartum, right? If she has some kind of hypertensive episode during labor and delivery, gets on some kind of medicine afterwards, has it for a year. What's going to happen after she loses that coverage? What's going to happen before she has that next baby, right? So there's that time period we have to think about with mom.
So that's why y'all are a part of this Cover Alabama Coalition organization saying, look, we need to close the coverage gap. Basically, it's kind of, expand Medicaid was the old sort of mantra. Now it's sort of, expanded to other things like maybe this public-private partnership that the state's been talking about with the governor's office. So you're saying women need to be insured. We've got to find ways to but we always have cost concerns, though. Every time this comes up, it's like, well, look, we got to make sure we can afford it. And now with some of the scale back gambling things, maybe does that worry you in terms of getting lawmakers on board for, finding ways to pay for the cost of something like this?
Well, we do know that the cost of this, closing the coverage gap, the numbers have been crunched, and it can pay for itself for the first 6 years, which is great. But we also know that a infant with complications like preterm birth costs 4 times as much as an uncomplicated birth. So we're having infants and moms who we're spending a lot of money on because they have things that cause preterm birth, and we can only mitigate so much of that during those 9 months. We need to mitigate during those 9 months, but also realizing that we can even prevent it even further so that we can lower that preterm birth rate. We have a very high preterm birth rate here in the state, and March of Dimes specifically, we focus on research. So we focus on research on how can we lower preterm birth, how can we lower infant mortality, how can we lower birth defects. And we have 6 different prematurity research centers that are doing that. But what we do know, and what we can do in the state right now that our research centers have shown, is making sure women have access to care. So we have an answer to that. We have an answer, and we're slowly trying to make sure in the state that we continue to have that coverage for families. A mother of 2 has to work, she can work 32 hours and at $15 an hour and still have no coverage. And that's someone that we need to cover. What if she has another child? What if she didn't have coverage when she had those 2 kids, until she had those 2 kids, right? So
she's in that coverage gap.
She's in that coverage gap. And that a single mom of 2 can be a single mom of 3, right? So we have to realize that moms fall in this coverage gap after they lose coverage after that 12 months postpartum, but even before they even have their first child.
Well, no, I'm glad you've come on to explain some of this, because all too often in the policy realm we focus on, well, this is a line item for Medicaid or whatever, but these are real, personal, and sometimes chilling stories, and very real. Look, we're out of time. Thanks again, Honor, for coming on the show.
God, thank you for having me.
We'll be right back.
You can watch past episodes of Capitol Journal online anytime at Alabama Public Television's website, aptv.org.
The Carver Theater was erected in 1935 on the corner of 4th Avenue North and 17th Street North in Birmingham. The Carver was one of several theaters in the 4th Avenue area offering first-run movies to African Americans. Today, called the Carver Theater for the Performing Arts, the space has been the home of the Alabama Jazz Hall of Fame since 1993 and serves as a museum and performance venue.
That's our show for tonight. Thanks for watching. We'll be back tomorrow night at the same time with more coverage of the Alabama Legislature, right here on Alabama Public Television. For our Capitol Journal team, I'm Todd Stacy. We'll see you next time.